Hello, this is Dr. Stanley Lang. Welcome to this video. And the topic is safe ketogenic diet, and do I need to test myself to do this correctly? So there's a lot of different aspects to doing the ketogenic diet well and doing it safely. I came across a very common issue with one of my patients today who I had not seen for a while, was attempting to do the ketogenic diet to reverse his diabetes. And in many ways, he'd been quite successful. He was definitely shifting to a very low glycemic eating strategy, and he thought he was eating ketogenic, but there were some changes in his lab that had not improved that suggested very strongly, actually probably proved, that he was still in severe insulin resistance. And what that means is that he wasn't probably in ketosis. Now, I have to say wasn't probably, because we didn't do any measuring today either, but the problem is he hasn't been measuring. So if you don't measure whether you're in ketosis, then in a sense, you really don't know. Now, after you've measured for a while and you know your own patterns, then you can know pretty well whether you're in ketosis or not simply by the patterns that you're following with your eating. But in the early stages of attempting to follow the ketogenic diet, if you're not monitoring yourself, either with serum levels with a blood stick or the breath analyzer, you're not going to know if you're really in ketosis. The urine testing is not an accurate way to do this kind of monitoring. And so I encourage all of my patients who really are serious about following the ketogenic diet to monitor themselves, because that's the only way that you can make decisions about whether the previous meal kept you in ketosis or not. And a lot of times people are consuming not too many carbs, but too much protein. And that's the biggest mistake that people that think that they're doing the ketogenic diet make. Now, a lot of people are eating way too many carbs also because of so much misinformation about what a so-called ketogenic diet is. There's a lot of stuff out on the internet and so-called gurus that talk about eating anything less than 50 grams of carbs as ketogenic, which is nonsense, of course. But the point is, if you don't measure, you don't know. And in this case, this person is trying to reverse diabetes. He's not just trying to lose weight. So it's really important for him to get it right. Now, it wasn't an emergency for him. He's relatively young. He's got time to get it right. So I didn't try to make an emergency out of it. But for somebody out there that is really dealing with issues and they're trying to reverse them and they're trying to use the ketogenic diet to do it, my strong opinion is you have to measure to know. You just don't know otherwise. You may be losing weight fairly rapidly, but still be doing it only by being low glycemic and reversing your insulin resistance sufficiently to lose weight by eating low glycemic, but still glucose based. And you may not be ketone based at all, but still be losing weight adequately. What's the significance of that? Well, there's a lot of benefits to the ketogenic diet beyond weight loss. And if you're making the effort to try to do that and you're 90% there, then with a little bit more effort, you can get 100% there. But that usually requires monitoring for most people. So I hope you found this helpful. God bless and have a great day.